This was a case report where we had a patient who had received an allogeneic transplant, and a couple of months after allogeneic transplant, that patient developed what seemed to be like an autoimmune-like hepatitis. We are calling it an autoimmune-like hepatitis because the biopsy picture, when the pathologist looked at it, looked exactly like autoimmune hepatitis. But of course, this patient's immune system now was alloimmune. He had received a transplant from somebody else. And so this patient presented with pretty severe hepatitis and a very high immunoglobulin level. And the biopsy showed a number of plasma cells. And so we couldn't use some of the traditional treatments, such as mercaptopurine, that are used for treatment of, or azathioprine that are used for treatment of autoimmune hepatitis. But given that we found a number of plasma cells in the biopsy, we decided to use a monoclonal antibody, Daratumumab. And to our surprise, along with steroids, Daratumumab actually was very effective, reduced the number of plasma cells in this patient's liver biopsy significantly, and his hepatitis improved drastically. It was quite a surprising finding for us, and that's why our illustrious fellow, Dr. Becky Epperly, she's the first author in presenting this abstract at the TCT meetings, so that if others have also seen an entity like this, they can perhaps try Daratumumab if other agents traditionally used for treatment of autoimmune hepatitis are contraindicated or could not be used for some reason.